Hi, Brian Lehrer here. Up next, Brian Lehrer Weekend. 3 of our favorite segments from the week packaged together for you to listen to on the weekend. So enjoy, and I'll see you back on the radio Monday at 10 a.m. on WNYC and WNYC.org. It's the Brian Lehrer Show on WNYC. Good morning again, everyone. So this Saturday marks the start of the open enrollment period for this year for Americans who purchase your health insurance through the Obamacare marketplace. As you know, this year there's going to be sticker shock as the fight in Washington over renewing Affordable Care Act subsidies remains at a standstill. When the Trump administration released a preview of the available plans on healthcare.gov just yesterday, consumers saw their rates surge, quote, an average of about 30% for a typical plan in states where the federal government manages markets, and an average of 17% in states that run their own markets. That, per the New York Times, will explain what the difference is. But we're also going to help you navigate what's going on here and talk about the politics with Elizabeth Benjamin, Vice President of Health Initiatives at the Community Service Society of New York and co-founder of the Healthcare for All New York campaign. And she also has done a lot of work as what they call a healthcare navigator, helping people individually, at least in the past, work through their choices on the Obamacare market. So, Elizabeth, always good to have you on the show. Welcome back to WNYC.
Thank you so much. I'm delighted to be here.
What does that 30% number mean? What does the 17% number mean for states that run their own Obamacare markets?
Yeah, well, unfortunately, in New York, which runs its own Obamacare marketplace, that premiums are expected to increase by 45% for people who are going to be losing these enhanced premium assistance. The problem with the Affordable Care Act was it wasn't because it was enacted by Democrats who sort of followed congressional rules that you have to pay for any new federal expenditure. Of course, that was completely thrown out. That whole rule was thrown out with H.R. 1. The Affordable Care Act wasn't as affordable as it should have been. And so that was remedied with the Inflation Reduction Act and the American Rescue Plan by congressional Democrats and the Biden administration. The Republicans who are now in charge of Washington are letting those enhanced financial assistance expire. And as a result, the average increase in New York State for a couple will be about $240 per member, per month. So that's very nerve-wracking. I think the other thing is what's really likely to happen is a lot of people are just going to look at these new premiums and decide to, go bare or go become uninsured. And there's, an estimate that, millions and millions of people will end up going uninsured. Unfortunately, New York State is going to bear the brunt of all these cuts that are projected to happen over the next couple of years.
The Obamacare subsidies are at the heart of the government shutdown battle between Democrats and Republicans in Washington. The Democrats want these subsidies to be renewed at the enhanced pandemic levels, and the Republicans are not budging. Let's go through the arguments on both sides of the aisle. And let's take the Republican argument first, because they're saying that these were supposed to be temporary, enacted at the height of the pandemic emergency when a lot of people were unemployed. The country voluntarily shut down a lot of the economy, and there were all these ways to compensate so people could continue to afford their lives. And one of them was enhanced subsidies for the Obamacare health insurance policies. And the Republicans are saying, well, we're not in that period anymore, so why should the taxpayers continue to pay for enhanced subsidies? Let's at least go back to where we were in 2019. Why not?
Well, why not is inflation has surged and the cost of healthcare has not been controlled in America. And as a result, insurance premiums are extremely expensive. We don't regulate the prices that insurance companies pay providers. For example, Switzerland uses private insurance. Everybody picks their own private insurance plan, but the government, negotiates the reimbursement rates. We only do that for Medicare. So if we aren't going to control prices, then and our country's going to spend whatever it is, 18% of our GDP, we can certainly afford to spend more on helping individuals as opposed to the industry. So I think the other piece of it is, you know, there is money. We're talking about, whatever it is, 300 million billion dollars, whatever it is to extend the tax credits. But what would happen this summer is we gave trillions of dollars in tax cuts to very wealthy people. So I think we really need to think about, well, what do we want to do? Do we want to help the people, or do we want to just help very rich people and, insurance companies and the healthcare industry more broadly? And I would argue that we must help individual people, or more and more people will be uninsured, and all of us will end up paying even more in our own insurance costs, because what happens in healthcare, in theory, is all this shifting, and the providers increase their prices with the insurance companies to offset their losses for not having any kind of payment for uninsured people. So it's an irrational system. I think the enhanced premium tax credits put in the subsidies that we're talking about actually added a level of rationality in our system, but we obviously could do much, much more to control costs overall. The problem is, the Republicans have no plan for that. All they want to do is make people suffer and charge them more for health insurance. That's their plan.
Well, I'm going to tell you what they say their plan is to control Obamacare marketplace costs and other private insurance costs. But first, I want to invite our listeners to call in and share your latest premium bill. 212-433-WNYC, 212-433-9692. Did you look it up yet or get notified individually? If you get your health insurance through an Obamacare marketplace policy, 212-433-WNYC. Help us report this story. 212-433-9692. Call or text. And we know that this isn't only an issue for Obama marketplace health insurance policies. It's other private policies, too. So employers, employees with workplace-based insurance, what are you hearing about your premiums for next year? I know word is starting to go out in various workplaces. 212-433-WNYC. 212-433-9692. Call up and share your health insurance bill, or
Brian,
ask a question.
Brian, I'm so glad you mentioned employer-sponsored insurance. Our carrier has proposed a 30% rate increase for next year for our organization, claiming that the expiration of the Obamacare subsidies is why they have to charge so much.
Oh, what's the relationship as they see it?
Exactly. What is the relationship? It actually should have no relationship whatsoever. But I think, the whole industry is in a total panic. And so that's what they're telling, our broker, which I find very interesting, because in theory it should have nothing to do for large groups or mid-sized groups. Now, there are a set of employers who get actually there are small businesses and sole proprietors and freelancers who are obviously employed, who get tax credits, and their premiums will also be going up significantly as a result, because they are part of the marketplace. It's around 5 million people that have small businesses that are going to be affected.
And so listeners, share your health insurance premium bills or ask a question of Elizabeth Benjamin, Vice President of Health Initiatives at the Community Service Society of New York, which develops policies for and advocates for the needs of lower-income New Yorkers. 212-433-WNYC, 212-433-9692.
I did run some scenarios for some of my clients, if that would be helpful.
Sure.
So, for example, I helped a woman named Louisa, and I've changed everybody's names, but she's single. She's a writer. She has diabetes, and she's in her 30s. Her income is around $70,000, which is 460% of the federal poverty level. Right now, she's getting around $385 in financial assistance, but still has to pay $500 a month or $6,000 a year, on her $70,000 budget. That's substantial. But in 2026, she's going to have to pay $10,000 or literally a seventh of her budget on health insurance because she will have no subsidies at all. We have
Wow.
yeah, it's a lot. Another young man, Sunil, age 28, he came off of his parents' plan. He's now a freelancer. He makes $38,000 a year. He had no premiums through the essential plan. Our state is going to actually have to disenroll 450,000 people in July as a result of HR1 from our essential plan, where that low income people were able to get zero premium, zero deductible coverage, but I still had copays, so they weren't paying nothing. But he's going to have to pay around, $3,000 to maybe $6,000 a year, depending on what level of health insurance he gets from having no premium. So that's going to be a huge shock for him in July.
Let me let you linger on that for a minute, because that's a whole other track of this. And I know the essential plan in New York State is what you say. It's a zero premium plan for lower income people who qualify. The number that I've seen, I think you may have just stated it too, is like 450,000 people in New York State who are on the essential plan. And you say they're going to have to start charging thousands of dollars a year in premiums to those people because of HR1. HR1 is also known as the one big beautiful bill. So what did that bill do at the federal level that's making New York State add premiums to what was a zero premium policy for lower income people? What's the relationship?
So we expanded our essential plan. The old cutoff was 200% of poverty, and we were able to expand it under a special federal waiver up to 250% of the federal poverty level. So it went from, having a cutoff at 29,000 to 36,000. My, freelancer that was fitting in that like patch. And what's going to happen is under HR1, the financing mechanism is completely destabilized. What it does, what HR1 is eliminated eligibility for lawfully present immigrants, so people who are legally here. So all these younger and healthier lives are now being thrown out of the essential plan. And so we can no longer afford to run it at the 250% of poverty level, and we're going to have to drop it back down to 200% of the federal poverty level.
So it's not everybody who has a zero premium essential plan. It's that group from
it's the higher income group above
to $36,000.
The between like 30 and 36,000.
Nicole in Brooklyn, you're on WNYC. Hi, Nicole.
Hi, thanks for taking my call. I'm a family of four. And I went online and found out, we're going to be paying $450, maybe $500, depending on the plan, per person per month. It's like an enormous increase. Yeah. I work for small businesses. My husband is self-employed. He employs a couple of people, but, we are small business, people. We're working for small companies, and they don't offer health care. And this is just simply unaffordable. And I've had Obamacare basically since it started. My kids have had it, and it's, the price has changed year over year, but it's never ever come anywhere close to this. And, I'm in my 50s, and for the first time in my life, I'm like, how am I going to have health insurance? This is the first time I've ever faced this at an age where it's, not something I feel would be reasonable for me, not to have health care. My son has asthma. There's just a lot of reasons, but I just don't understand how we're facing this and how the Republicans are sort of standing on the sidelines saying that it's not happening when it's happening to so many of us. I can't tell you how many friends I have who are in the same boat that I'm in. We're all really scared about how we're going to cover these costs.
And I think a lot of your friends are calling and texting us because there are a lot of people, Nicole, in the same boat, as I don't have to tell you. Elizabeth, can you give her any advice in addition to whatever else you want to say?
Yeah, I mean, first of all, because you're self-employed, Nicole, you are potentially have a lot of deductions on your tax return. And so, what I strongly, strongly urge you to do is call and make an appointment with a health insurance enroller or a navigator. You can do that in two ways. You can call 888 614 5400. That's my organization. And then you can also call the New York State of Health Marketplace, and their number is, let me get it. I had it. I sent it in, and then of course it's 855-355-5777. So 855-355-5777. But I think working with a navigator who can kind of take the time, sort through all your paperwork, and maybe figure out what the best deal you can get. If your children are under 19, we can enroll them into Child Health Plus. That could potentially be much cheaper because that will have no deductible, no cost sharing, and then have you and your husband in a couples plan. So there's all sorts of configurations that we can do to help you. A lot of folks, are super tech savvy. The marketplace, you can do it on your own. It is not impossible by any stretch of the imagination, but there are like sort of little tricks of the trade, and that's what, us navigators are here for, and the people at the call center up in Albany are also there as well. So please get help.
Nicole, I hope that's helpful to you. And here's some texts that are coming in from other people in the same or similar boats to Nicole. This one says, I am self-employed and don't make a lot of money, but do not qualify for Medicaid. Right now, I pay $150 a month, and it will go up to $700.
Oh,
and that listener concludes the text by writing, I will have to go uninsured. And then another text says, 63-year-old woman in good health, $1,450 a month with $6,500 deductible.
Yeah.
So, that's a low-ish premium. I mean, it's a high enough premium, $1,400 a month, but a really high deductible. So the first $6,500 of health care also come out of her pocket.
Brian, I just want to make sure people are going on our state marketplace and not the federal marketplace. So do not look at healthcare.gov. Look at the New York State of Health marketplace. And the reason why I say that is on the federal marketplace, if you might be subject to age rating, which means it's more expensive the older you get. We don't do that in New York State. We have a solidarity principle where everybody pays into the system and pays the same amount in premiums.
Michael in Bayside has another insurance premium story. Michael, you're on WNYC. Hello.
Yes, hello. I'm calling regarding the current issue. Currently, I'm paying $536. That would be bare bones, bronze, not gold or silver or platinum, none of that. No dental, no optical, and with a $3,800 deductible. Got a letter from the insurance company, and it's going to be going up 15%. But the most recent twist on this is that I am facing a cancer diagnosis with prostate cancer. So, none of this is, and I keep getting these bills like you can't believe it. Like, I'm trying to take care of myself, and I'm like, what is going towards the deductible? And I'm shocked how, like, with the $3,800 deductible, that it doesn't, what I'm paying is not really going towards the deductible, only a portion of it. I don't know where it's going. And I'm getting bills from anesthesiology, for just standard, like, colonoscopies. It's costing me an arm and a leg, pardon the pun. I don't know how this future, cutting all these benefits is going to benefit anybody, except perhaps an elite few, maybe. I don't know what's going on out there. It's just weird. This is not for the people at all, and it's really unsettling,
Elizabeth,
so
talk to Michael.
Yeah, Michael, yeah. I'm so sorry. We would, first of all, if you're concerned about the deductible not being, pulled down, if you're concerned about the accounting that the carrier is doing around your deductible, please call us. Our community health advocates programs helps people with insurance. It's the same phone number. So if you need an enrollment appointment, we get you in, an enrollment appointment. But if you need help, making sure the insurance is paying what it should be paying, then please call Community Health Advocates at 888-614-5400. We can also help you apply for hospital financial assistance. So if your treatment is hospital based, we can work with the hospital to have them discount the care that you receive or work out a payment plan for you. All hospitals in New York State are required to offer hospital financial assistance to people with incomes below 400% of poverty, which is $63,000 for a single. So it may be that you're eligible for that. And actually many in New York City, you're based in New York City, go much higher than that. So we're here to help you with your bills. We're here to help you with your insurance claims. Please call us.
Michael, good luck with that, and thank you for...
And I'm so sorry about your diagnosis.
Yeah, really. And, maybe your situation helps others just by hearing Elizabeth's response to you when others who may be in some kind of similar situation hear your exchange. And you know what we're going to do? I had promoted a call-in for the end of the show, and we're not going to do that call-in. We're going to keep Elizabeth Benjamin from the Community Service Society for the rest of the hour, our last 15 minutes this morning, because there's so much else with this happening right now with people's new health insurance premiums for 2026 that we want to get into, including some of the longer-term solutions. The Republicans claim that they do have a solution, and it's different from the current system. Then there, of course, are people who say, hey, now it's time, because Obamacare has proved that to some degree it's collapsing of its own weight. Now is the time to actually have a Medicare for all, universal health care, Bernie Sanders style debate. So we'll talk about those things, as well as more of your stories of your health care premiums and what to do about them right now. Stay with us. Brian Lehrer on WNYC as we continue to talk about your health insurance premiums bill as open enrollment is beginning for the many of you on Obamacare or Affordable Care Act, health insurance policies, and the continuation of the current subsidies for those premiums that the Democrats have made the central issue for them in the government shutdown. The Republicans want the expanded subsidies that were enacted during the pandemic to expire. And so, as you've been hearing, we're giving you some personal advice from Elizabeth Benjamin, Vice President of Health Initiatives at the Community Service Society and co-founder of the Healthcare for All New York campaign. She's an experienced Obamacare marketplace navigator in addition to being a policy advocate. So we are always grateful and learn things when Elizabeth Benjamin comes on the show. So we're taking your stories as well as politics questions at 212-433 WNYC 212-433-9692. Elizabeth, I want to ask you about reasons. Oh, and we're going to try to get in New Jersey. She works in New York, and we're going to try to get the equivalent New Jersey number or something equivalent to the one that she's been giving out for New York callers. You have it? You want to do it now?
Sure. So New Jersey has a marketplace called Get Covered New NJ. And if you go onto the marketplace, first of all, their customer service number is 833-677-1010. 833-677-1010. But if you go on their website, for those of you that use, the World Wide Web, they have a thing saying we can help. It's a little dashboard across the top, and then it says find the local assistance, and then you can find agents, brokers, assisters that can help you enroll in coverage.
Great. And what was the number again on the New York side that you were giving out?
Oh, sure. Okay, so there's our phone number, which is 888-614-5400. And the New York State of Health Marketplace phone number is it's 855-355-5777. 855-355-5777. But if you want to talk to a local navigator here in New York, it's 888-614-5400, and we help everybody. We have navigator programs in nearly every single county of the state. So you
Again,
can get in-person or over the phone assistance.
888, because I know these go by quickly, 888-614-5400 or 855 for the marketplace, 855-355-5777. How many?
And in New Jersey is 833-677-1010.
Why are premiums spiking without government subsidies? Does it have to do at all, as I've heard in some reports, with insurance companies now covering the drugs like Ozempic and Wegovy more, and they're very expensive, and any other upward pressures before we even talk about how to solve it?
So insurance premiums in New York State, with really in the individual market, we're slated to increase by 7%. And yes, the Wegovy, Ozempic, some of the other pharmaceuticals do, drive prices. We also have no capacity for controlling healthcare costs. So, some of the wealthier hospitals charge well over 400% of of Medicare, and less well-endowed hospitals only charge, 125 and 150% of Medicare. So we have no mechanism for controlling hospital prices, which is the biggest part of any single insurance premium spending. But the real reason why if you take away these enhanced premium tax credits, so insurance, people just don't get as much financial assistance. If people don't get as much financial assistance, younger and healthier people are going to say, well, that's a little, I don't have an extra $100 or $200 in my monthly budget. I'm young, I'm healthy, I'm just going to not get insured. And that happens in droves whenever they're very price sensitive. When the younger and healthier, and then eventually when legal immigrants leave our individual marketplace in New York State, that means premiums who's left are sicker and older, and that means premiums spike under that whole, just through the basic principle of insurance solidarity, which is, you were saying Medicare for all, which is why a program like Medicare for all makes more sense, because everybody's just automatically enrolled and you don't have the vagaries, and prices are set by the government, and you don't have the vagaries of, random hospital in Bedpan Alley saying, oh, I'm going to charge 600% of Medicare, and you have to take me because everybody wants me. And then you also don't have, all the young people leaving the system because they're automatically enrolled in the system. So that's why Medicare for all obviously is a better system, but it will be very hard for any single state to move forward with Medicare for all under the current federal government, which I don't think has any appetite to support that kind of state-based experience.
That's at the state level. And I know one or two states have tried it, and it's been really hard because the pool isn't big enough. Certainly Bernie Sanders would argue that this is why this should be at the national level. And I wonder if Obama breaking down to the extent that it has might clear the way for a fight for single payer to rise up to, a more prominent place in our national politics. For you as an advocate for single payer, you think that's politically possible soon?
I mean, I hope so. Because we're having such a regressive conversation now, it feels, I feel like the most important thing is for everyone to get on the phone and call our 7 members of Congress who voted for the one big bill, beautiful bill, and say, please, please put, pressure on Speaker Johnson and the Republican leadership to work out some kind of deal to help people in the here and now. And then I do feel people should be supporting, the Medicare for all and Bernie Sanders's, bill. Absolutely. But we have a crisis that starts on January 1st here in New York State, and we have to address that right now.
Yes. One of the things the Republicans say is that the price of health insurance on the Obamacare and other private markets is going up because the law requires so many things to be covered in every policy. And if people were able to choose, who are especially younger, healthier people, could choose lower cost policies that don't cover as much, that maybe only cover them if they have a real catastrophic need or something like that, then the price for everybody would come down. What's your response to that?
Sure. You could have junk insurance, but then it's not really insurance, is it? Like, yes, you could have a health insurance policy that doesn't cover hospitals, but if you get hit by a bus, then you don't have insurance. So what's the point of having insurance that doesn't cover basic benefits? I don't think the issue really is what benefits are being covered. I think the real issue is the fact that we aren't controlling prices. All the evidence, and there's reams and reams of academic journal articles on this. In fact, it was all started by a guy named Huey Reinhardt, who used to be at Princeton, who, in the Clinton administration wrote a seminal piece saying it's the price is stupid, making fun of its economy stupid, which was, I guess, the James Carville quote. And, that's the reality of the problem. That's the root cause of American healthcare system not being efficient.
But you can't force doctors or hospitals or pharmaceutical companies to lose money, they would probably say. So you can't just control prices. That's an argument on the other side.
Well, you can, and many other countries do that. As I said, Switzerland uses a private insurance system and regulates the prices. Other countries negotiate drug prices. The fact that we have the wild, wild west where any doctor, pharmaceutical, medical equipment, hospital can just charge whatever they think the market will bear, and the insurance companies make more the more they're charged, right, by all those actors. Everybody's making money in the healthcare system.
So they would have to raise taxes, though, right?
No, I think they would have to. You could control costs. You could have, many states are doing this. For example, Delaware has hospital rate setting. Maryland has a global budget. Other states, California set up a Office of Healthcare Affordability that's looking at mergers, which also, hospital mergers, which also drive out of control prices. So no, there's lots of things we can do at the state level to regulate prices that could really, we only spend 4% of our insurance premiums on primary care. That's insane. We should be doing 10% because 70% of our emergency room visits could be treated in a primary care setting. So we're incentivizing all the wrong things.
One more listener story. Victoria in Manhattan. You're on WNYC. Hello, Victoria.
Hi. Thank you for taking my call, and thanks for having this really important issue. So we have a small firm. We have 6 full-time staffers. We provide health care, and we're looking to maybe hire somebody, but now with the fact that we're going to have to, the cost of insurance is going to increase for everybody, I'm not sure if we can manage a new hire. So I don't think we're really understanding and grasping the whole ripple effect that this has on small businesses and on our economy in general. So I think that's really important. And just full disclosure, I am a Democratic district leader, and I hosted a town hall on the New York Health Act a few weeks ago, which I think is really important that we start to understand what our options are if the federal government is going to fail us.
Victoria, thank you. Elizabeth, a last thought, 30 seconds.
No, thank you for holding that town hall. I feel like, health insurance is so confusing to people, but it doesn't have to be that way. We're here to help you. Please call us 888-614-5400. We're at the Community Service Society of New York. We're here to help people. And if you want to stay up to date on policy issues, the Healthcare for All New York website's a good place to go. Please, if you can, please reach out to the members of Congress in New York State that voted for the One Big Beautiful Bill. We really need them to, extend these enhanced premium tax credits and to undo or delay some of the damage of that bill.
And listeners will put those New York and New Jersey insurance information help numbers on our website. Elizabeth Benjamin, Vice President at the Community Service Society. Thank you so much.
This week on the New Yorker Radio Hour, Jon Stewart on why America keeps falling for Donald Trump.
When someone comes along and goes, the system is rigged, and people go, yeah, it is rigged. Now, he's a good diagnostician. I don't particularly care for his remedy.
Jon Stewart on the New Yorker Radio Hour from WNYC Studios. Listen wherever you get your podcasts.
It's the Brian Lehrer Show on WNYC. Good morning again, everyone. Now we continue our election series, 30 issues in 30 days, and we're in the final stretch of our series with issue number 28 today. Should New York City keep, expand, or eliminate its so-called safe injection sites? Now, those sites are intended to allow people to use certain illegal and dangerous drugs in a supervised setting. Currently, the city has 2 such sites, which were established after the pandemic under Mayor Eric Adams. Here are all 3 candidates from last week's mayoral debate answering a question from my co-moderator, Errol Lewis of New York One, during a lightning round.
Would you expand, decrease, or keep the same number of so-called safe injection sites for drug users in the city, Mr. Mamdani?
Can you say the options again?
Expand, decrease, or keep the same?
Keep the same.
Mr. Cuomo?
Keep. Close them down.
Republican candidate Curtis Lewa speaking last there, saying close them down. The breakout news was that Democratic candidate Zohran Mamdani, a longtime supporter of expanding the sites, now seems to agree with independent candidate Andrew Cuomo to keep the number the same, just 2. So now we'll cover issue number 28 by first explaining what services these safe injection sites provide, and then breaking down the conflicting politics surrounding them, and specifically why Mamdani's view may have shifted on the subject. With us first is Sam Rivera, Executive Director of On Point NYC, a nonprofit in East Harlem with a sister location in Washington Heights. On Point is one of the providers of what is sometimes referred to as harm reduction services for opioid users. Also on the line is Ethan Geringer-Samuth, healthcare reporter at Crain's New York Business, who has covered this topic. Sam and Ethan, welcome to WNYC.
Brian?
Good morning, Brian. Thank you.
And Ethan, we'll get to you and your reporting in a few minutes, but we'll start with Sam. Sam, tell us a little bit about On Point, where your services are located and what you provide.
Sure. On Point is a well-rounded, fully funded, health intervention wellness hub. It's a long title, but it's the best way to explain what we do. So we provide an array of services both in East Harlem, brick and mortar in East Harlem, Washington Heights, and then we provide services in the South Bronx as well. So we are known as a harm reduction organization. We've been in the community for over 33 years, and it's important to share that because people tend to confuse us. And yes, we provide an array of health services, specifically around folks who use drugs. Not only folks who use drugs, but primarily folks who use drugs, case management, food and nutrition, showers and laundry, holistic health, which includes acupuncture, acupressure, massage, etc., mental health services, and a bunch of other services. And of course, we also have a very large footprint in the community through our outreach and public safety team. Just the last thing I want to say, we have OPCs, overdose prevention centers, not injection sites. Part of that is intentional. That language is intentional, and we want to make sure people are clear that they're not just injection sites, and primary goal, is to keep our folks alive.
Right. So Errol, in the lightning round question, used the term so-called safe injection sites. Yes. Other articles mention harm reduction centers. You just used the term that you used, but you cited multiple sites that On Point has, but the reporting I've seen says there are only 2 of these, what are referred to as safe injection sites. So are there some where you offer that service and some where you don't?
Yes, so our 2 brick and mortar locations, one is in East Harlem on 126th Street, and the other is in Washington Heights on 181st Street. Those are the 2 places where we offer those services. The other services are provided through our outreach and public safety teams.
And earlier this year, to give listeners some context, the health news site Stat News reported on Point, and they wrote On Point began offering supervised consumption services. That's how they describe it, supervised consumption services in 2021. And it says, in that span, its records show it has reversed over 1,700 overdoses without a single participant death. That from Stat News. And that number was reported even higher in a good way by our guest from Cranes. So you want to make your pitch to our listeners? How does On Point reduce the number of deaths caused by drug overdoses? And why would you argue, I presume, to expand the number of such sites?
Yes, I go back to before we opened, and what was happening around the United States was this narrative that spoke to not having enough evidence throughout other countries. And so now we're here, and we're coming up on our 4th year, and exactly what we expected is happening. And it's exciting. If you hear some emotion in my voice, it's because we're keeping beautiful New Yorkers alive, and it impacts me in this work, something I've been committed to for over 30 years. And I think about our amazing staff who provide these services. So yes, coming up on year 4, we have almost 7,000 registered participants who specifically use the overdose prevention centers. We are close to 2,000 overdose interventions. That number has increased since that article. And yes, 0 deaths still. Exciting, always exciting to look at that number, which has been consistent around the world. And then two other very important numbers are over 7,000 units of hazardous waste. So if we talk about expanding, these are just 2 New York City, in fact, 2 Manhattan neighborhoods. Can we imagine, and we can imagine what it would look like if we had sites throughout the city. The impact would be amazing. And the other thing is over 230,000 utilizations, Brian. And what that means is 230,000 times people used inside with us in a safe environment, keeping the community safe, keeping the community clean and clear of hazardous waste, supporting beautiful people who want to stay alive, and really impacting the community also financially. When we look at those responses to overdose within our 2 programs, we look at the cost, and it's over $50 million saved in just 4 years. And the other thing that we don't talk about enough is the impact on a global scale, and what this means, that now we have interventions we can measure in the United States and specifically in New York. So it's an exciting time. Expansion is something we need. It's known we need it. It's not an easy thing for folks to respond to, but it's clear we need them. And I look forward to us expanding this health intervention, which is also evidence-based.
And before I let you go and move on to our other 2 guests on this topic, I will note that Stat News did report on some of the opposition to this. It says some opponents cast supervised consumption sites as places of hopelessness, a white flag in the war on drugs, a decision to enable and even encourage drug use rather than oppose it. And of course, others bring up the potential or reality. You can give a reaction to that, and our reporter guest will too, whether it's real crime and disorder around these consumption sites. So what do you say to the critics?
Right. So a couple of things. Crime and disorder it's actually there's already been a couple of studies which disprove that, and actually prove that the crime has been reduced in the two areas where we're located. And I'm really glad you're asking this at this moment. What was
and
the
here,
first
by the way, is a text that just came in. Listener writes, "It doesn't keep community safe or clear. Drug use is blatant, open, and quite aggressive." But go ahead.
Yeah. Well, I mean, I obviously don't agree with that. There's a tremendous reduction. I just told you and shared with your listeners how many hundreds of thousands of utilizations have happened. No, we do not we're not able to get everyone to come in, which is why we have such a strong outreach and public safety team. So when we look at that, crime is down, the health of the community is up. I understand and have always respected the view of community members and the way they see it from their lens. I do understand that. Our goal is this. Many people say send these people into treatment and detox. That's where they belong. Brian, of the over 6,800 participants, they have all been to detox and treatment more than 5 times. What we're trying to figure out with them is what's missing for them in between. What's missing for them when they come to us and they get their first visit to see a doctor or nurse in our program. Something is missing in the system. And what we know is being there for them in that moment is what matters. We do not get new people coming in using drugs. So encouraging people to use drugs makes zero sense. In fact, all of our participants are people who have used drugs for a long time. And the thing is, too, the assumption that we don't do anything to help them stop using is it's really sad and quite painful, especially when we have had lots of recent success with long-term medically assisted treatment provided in our sites.
And just about the neighborhood effects, and I'll note that we have callers and text messages coming in with enthusiastic support and whatever the opposite of enthusiasm is in opposition. But that same listener writes, a little more from that person's text message, since the so-called safe injection site opened in Washington Heights, so I guess that's yours, our neighborhood is overrun with drug addicts shooting up all over the place. It's truly terrible that young children have to witness and normalize and possibly mimic this behavior. So what do you say to people who feel like that?
Again, I respect what they feel. I don't agree. I don't agree what I mean by, wait, let me be careful. What I mean by what I don't agree is that it's rampant, as they say, because we know factually it isn't. The reality that us opening these sites brings people in is really what prevents them from being outside. And the reporting, again, I get the vision and the people walking the community. I totally get that and respect that, and the organization does. The reporting doesn't support that at all. It just doesn't. And that's that we always go with that because we're not a part of the reporting. We're not the researchers. We have other folks who do that part of it. And you know, the numbers I'm giving are facts. They're not made up. They're not theories or opinions. These are true facts. Again, Brian, we respect the community. I hear them anytime and every time they share this. The other thing I'll just say quickly, people tend to talk about when we opened 4 years ago. And the reality is we were providing similar services for over 6 years prior. So when I ask people that question, it's clearly based on when they found out when our services became public in that way. And so to look at it from that lens, I get it. I understand it. I'm a person from the Lower East Side, grew up in the Lower East Side, and understand and respect that process. I also ask people to look at the reality. The other thing is we allow people to tour and visit. And so community members should tour and visit and see what we're offering and understand what we're doing a lot better. We want to be continue to be supportive in the community.
Thank you very much. Sam Rivera, Executive Director of On Point NYC, a nonprofit in East Harlem and Washington Heights. It's one of the providers of what's sometimes referred to as harm reduction services for opioid users, including what is sometimes referred to as safe injection sites. And what was the alternative term to safe injection sites that you said you prefer?
Overdose prevention centers. And its primary goal is to keep people alive. The other thing I forgot to mention very quickly is it's something we cannot measure. And that's the number of overdoses we actually prevent simply by people being indoors with us, not rushing and injecting in a park where we don't want them, in an alley where we don't want them, in a public bathroom. So being inside with us, one of the things I struggle, and I really want to give the staff so much credit, but we can't measure an actual number, are the numbers of overdoses we've actually prevented by creating a space that's safe and healthy in every way possible. Lastly,
and let me leave it there because we're short on time and you've been on for a while, but I really appreciate you coming on and talking about that. And certainly the reporter from Cranes, who we're going to talk to now, does back up the last thing that you said about preventing a lot of overdoses and citing the number 1,900 of those since you went online a few years ago. So, Sam, thank you very much.
Thank you, and thank you for allowing us to share from our perspective.
And again, listeners, we're doing this in the context of issue 28 in our 30 issues in 30 days election series. Should so-called safe injection sites be expanded, kept the same, or shut down in New York City? In the debate last week, Cuomo and Mamdani said keep the same number. Curtis Sliwa said shut them down. It was newsworthy because Mamdani used to advocate expanding the number. So now we turn to Ethan Geringer-Samuth, healthcare reporter at Crain's New York Business, who has covered this topic. Ethan, was that a surprise to you to hear Mr. Mamdani say keep the number the same in the debate last week?
Hi, Brian. Yeah, that was a surprise. Mamdani has supported the expansion of these, at least in his public statements, as recently as the primary. He answered a questionnaire with the news outlet The City, saying that he supported the expansion of these sites to be equitably distributed across the city, along with other substance use treatment programs. I believe the debate was the first time I had heard him say publicly that he wanted to keep the number the same, that is, not expand them, but also not decrease them. He's also long sponsored a bill or been a co-sponsor of a bill at the state level to create a state-level program for these overdose prevention centers. He's been a co-sponsor on that bill since his first term in office.
And you wrote on a possible reason for Mamdani not calling now for expansion. You wrote, since becoming the Democratic nominee, Mamdani has increasingly become a target of President Donald Trump, who has threatened to withhold federal funding and deploy troops to the city if he's elected mayor. A month after the primary, on July 24th, Trump targeted the sites explicitly, unquote, from one of your articles. So what has Trump said about these sites?
So in that July 24th order, the president instructed the attorney general to review whether the sites are operating legally and bring civil or criminal action against them if they're not. It also instructed the HUD secretary to review whether these sites are using federal housing dollars and if those are being used appropriately. If not, they should be frozen as well, according to the executive order.
And on Cuomo's record, you note he supported the creation of overdose prevention centers, but resigned from office amid sexual harassment allegations before they opened. But you were in touch with a Cuomo spokesperson, I see, after the debate last week. So what's his logic regarding keeping the number of centers, 2 in total, the same?
The argument from the Cuomo campaign was basically that there needs to be a balance between the public benefit of saving lives at these centers that Sam mentioned and the concerns of the community, which was reflected in the text message you read.
Let's take a phone call from somebody in support and somebody more not in support. Keisha in the Bronx, you're on WNYC. Hello, Keisha.
Hi, how are you? Good morning.
Good morning.
Thank you for letting me come on. Hi. Yes, I am a Bronx resident, East Tremont section of the Bronx, and I am in support of the OPCs. Just from my experience of dealing with folks in my area, especially folks who live in encampments in some of our parks, and seeing their situations where a lot of them, they do, use in the park, but a lot of them, from my experience with seeing them, try to be as discreet as they can. I think a lot of them, just even speaking to some of them, they don't want to use openly in front of people, in the public. A lot of them try and be private. They try and be discreet, but a lot of them are homeless and have no place else to go because a lot of these shelter systems are just not the most best places that they want to be, for different reasons. And so I believe that OPCs would be better, not just for them, but for the community, because, yes, as a resident, I understand a lot of people don't want to see the open usage in public areas, especially because of children. I totally understand that perspective. I believe that if the community understood how beneficial these OPCs would be in especially neighborhoods like where I live in the Bronx and just other areas where you want to keep them in a place where they have their privacy to, do what they need to do because of their situation and not be out in the open, exposed to the view of the public. Mm-hmm. I see that as a benefit, but also to these OPCs also provide other services. They provide services. These people are in deep pain and trauma. A lot of them come from very, very traumatized backgrounds. And so it's not just a place for them to go and use, but it's also a place where they could get services, where they could get counseling. So they can get medical services.
And Keisha, I'm going to leave it there and get to another caller. We really appreciate you calling in. And again, listeners, the initials OPC stand for Overdose Prevention Centers, if you didn't get the initials there. And Daniel in Manhattan, more of a skeptic in Washington Heights. You're on WNYC, Daniel. Hi.
Yeah, hi, Brian. I'm against the way they've been run. None of us citizens here were even told about these centers until it opened. I also, I live here in Washington Heights. I also have a business down in Harlem. It's all over the streets on 125th. You can't believe people passed out.
These are the locations of the two sites, right?
Yes,
and then the only two in the city.
Yeah, well, why aren't there some in Astoria, and Bushwick, or Gramercy Park? Why is it always Washington Heights and Harlem is the dumping ground? They want to close down Riker, and guess where they want to put the new prisons? Up here in Washington Heights. Now, I have 3 children. I have seen people injecting right at 181st and Fort Washington, right outside my favorite bodega and across street from a Starbucks, just shooting up. I've asked them, please don't do that. My children are with me. I get a big F off, okay? These people, I believe, who are coming around these sites are just collating or gathering around these sites because that's where maybe drugs can be found outside of the site. But it's going to become a political issue because we're not being represented. We don't have a seat at the table. I mean, just the average citizen. And now where I'm at, up here where they call Hudson Heights, we've exploded with families of children and everything. And suddenly over like the last year, we have all these people injecting down on the subways. There's needles all over the place. And we also have beggars like we've never had before. People asking for money, standing outside our grocery store, standing at the 183rd entrance, standing at 181st, going over to 190. They're in Fort Tryon Park. It's like everybody has gravitated to this area. And when we talk to citizens, nobody has any. It feels like they have any say in it. Go ahead.
Daniel, I'm gonna run for time, but I hear you, all those things, and we hear the caller before you making cases for. So Ethan from Cranes, have you been able to verify as a journalist that conditions are as bad as Daniel says?
I think the studies that are often cited by the harm reduction community say that open air drug use actually decreases around the sites. I haven't witnessed myself the drug use that some of your callers have mentioned, but obviously, at least the perception of this has been a factor in the campaign. As I said earlier, the Cuomo campaign is responding to that perception. I should also note that the tune of the federal government, while more targeted in that executive order that President Trump signed, hasn't changed a whole lot. Under President Biden, there was also concerns raised by the Southern District that these sites were operating illegally. and federal dollars have never actually been allowed to be used for the safe injections or overdose prevention work.
Very briefly, because we have one other guest on this, State Senator Gustavo Rivera standing by, was the caller asked, why always in Harlem and Washington Heights, or in this case, why only in Harlem and Washington Heights? Why not Astoria was one place he mentioned, or other neighborhoods that he mentioned around the city? Why only two, and why these two in 30 seconds?
Well, I think, one of the arguments for expansion is that it would put less pressure on these few sites. As Sam said, there's been more than 200,000 visits just to these two sites alone. So that has been one of the arguments for expanding the program, as well as bringing the benefits that Sam described to other neighborhoods.
Right. But as to why they started only there? If you're not sure, that's okay.
Yeah, I'm not exactly sure. I think it might have to do with the demand. Manhattan has the second highest opioid overdose rate in the city after the Bronx. So these are concentrations of people using
and a couple of people have texted to say Mamdani isn't the only one who changed his position on this. We should also be saying Cuomo changed his position on this. Did he change in some way? Listener writes, for example, you keep framing things as Mamdani changing his mind, but Cuomo does too. He changed his mind in 2021 on safe injection sites for no other reason than he hated de Blasio. But your reporting was Cuomo supported the creation of overdose prevention centers. So has Cuomo changed on this too?
Yeah, there was some reporting in 2021 from the city and from New York Focus about how Cuomo had made commitments to harm reductionists that he would have his commissioner sign off after the 2018 election, but by 2021 he still hadn't done that. I'm not sure that publicly he had said that he no longer supported the centers, but at least privately and to harm reductionists, he had, according to these reports, said that he was no longer sure that he supported them.
Oh, but then I guess you could say he changed again, because in the debate last week, he did support maintaining the two that have already opened.
That's true.
My guest for this portion of the conversation has been Ethan Geringer-Samuth, healthcare reporter at Crain's New York Business. On issue 28 in our 30 Issues in 30 Days series, election series, safe injection sites and other opioid harm reduction measures as an issue in the New York mayoral race. Ethan, thank you very much.
My pleasure, Brian. Thank you.
And finally, briefly with us now is State Senator Gustavo Rivera from the Bronx. He's been an advocate for safe injection sites as well. Senator, hi, welcome back to WNYC.
Pleasure to be with you, Brian. And I actually have answers to most of the questions that you asked, by the way. I can get right into it if you'd like.
Well, tell me why this has been an interest of yours. Is it a particular problem in your district? And I guess one of the things that our last caller would be wondering is, if so, why isn't there a safe injection site in your district?
That's very important to say. First of all, the reason why there's only two sites is because those were the sites that were approved under the de Blasio administration as he was going out. There is a bill that I've had for years in the state to actually authorize them and regulate them across the state of New York. It has not passed, but what de Blasio demonstrated is could be done by an executive order. These organizations were on point, was ready to put them together, and so they were ready at that point, so that's why these two sites exist. And to their credit, as much as I have criticized Eric Adams, they have always been supportive of the sites remaining there. And so that's the reason why there's only two sites. I want one in the Bronx. I am out openly advocating for one in my community, and there's all sorts of complications related to the organization being ready, the space being correct, community involvement, etc. But there's all of that. By the way, as far as Cuomo is, you will not be surprised to learn, full of it. He said that he was supportive during most of his tenure, and he consistently dragged his feet throughout all of it. So he was talking out of both sides of his mouth, as he usually does. to harm reductionists and to folks saying he was going to put them together, and they never actually happened. So there's that.
I see, am I right that Mamdani in the legislature has been a co-sponsor of your Safer Consumption Services Act?
I believe he is a supporter of the bill, yes.
And so were you surprised to hear him say that he only supports keeping the two sites that already exist now in the debate?
Well, I will tell you this. I disagree with I support Zoran fully, and I look forward to talking to him at length about this after he becomes mayor next week. But I think that what's important here is two things. First of all, there is the Department of Community Safety, which he is certainly going to focus a lot of his energy on. There has to be an inclusion of people suffering from drug addiction and overdoses, etc., in that plan of public safety, the community safety department. Because the reality is that there's so much criminalization that happens because of drug use, so that has to be addressed there. And actually, in relationship to this, and actually to answer a question you asked earlier in relation to one of your earlier callers, if criminalization and stigmatization worked, we would not have an overdose problem. We would not have an addiction problem. Addiction is not a moral failing. It is a medical problem. So therefore, it must be dealt with as a medical issue. And by the way, one more thing. There's so many folks who are criticizing, and many of them do it in good faith, but many of them do it in bad faith because they're not even willing to visit and see what works there, see what happens there. This is not a chaotic place. It is a place where good work happens and where a lot of services are available. As Sam says all the time.
You heard what a couple of listeners chimed in about how chaotic they perceive it to be in their neighborhoods.
And I would say to many of them, just like I do with people in my district, I've actually taken them to tour the location so they can see the actual work that happens there. And so that your listeners can understand this. As Sam says all the time, this is Sam Rivera, who you just had on, the least interesting thing that happens in those places is the room where the actual drug use occurs. Everything else that happens around it, the medical care, the mental care, the counseling, the food available for folks who need it, et cetera, these services that surround the place where people use are actually, internally, it doesn't happen outside, and it actually means that they're connected to services to actually get better. And one thing,
let me ask you one last question in our last minute, and I have a feeling I know what you're going to say, but how do you feel about the Trump administration's efforts to cut down on the amount of fentanyl in the United States in the first place? That's one of the topics of his negotiations with Xi Jinping, who he's going to meet with this week. And of course, there are the attacks on the suspected drug boats now coming up from Latin America.
Well, that's obviously a large question that has to do with international relations and abuse of power in international waters, et cetera. But what I will say, just to underline this, if criminalization solved drug use, solved drug addiction, and solved overdoses, it would have happened already. And to some of the listeners who might be opposed to these overdose prevention centers, I would say to them, you can't have it both ways. I don't want your child to see somebody shooting up in the street. I don't, which is the reason why I support a place where they can use on medical supervision and with care around them so they can get connected to services that actually will get them to not use anymore or to be in a better place. So I believe in them. I will continue to support them, and I will do so under the next administration as well.
State Senator Gustavo Rivera from the Bronx, Riverdale, Pelham Parkway, Van Ness, Belmont, Norwood, Van Cortlandt Park, Bronx Zoo and Botanical Garden area. A lot of the Bronx represented in the State Senate by Gustavo Rivera. Thank you for joining us on this.
Thank you for having me, Brian.
So we're going to end with a call-in to shout out your costumes inspired by the news or current pop culture of any kind. Your costumes that are political or otherwise inspired by the news, or something else that's contemporary. You know, we don't want the witches and the ghosts and that kind of thing, but how about a 2025 pop culture reference costume or a 2025 politics reference costume or anything else inspired by the news of now? 212-433-WNYC, 212-433-9692. Call or text. I mentioned at the start of the show that someone told me this morning off the air that they're going to go with a red beret, and then everybody knows she's going as Curtis Lewa. So how about any other political costume? 212-433-WNYC, 433-9692. Maybe you're going as the actual potato chip bag that briber apparent. Winnie Greco offered reporter Katie Honan on behalf of then-candidate Eric Adams. That might be a tough costume to make. Maybe you're going as the government shutdown. We've actually seen an interpretation that's a Statue of Liberty costume with a "Sorry, we're closed" sign around the neck. Do you have another punny interpretation of something political right now? 212-433 WNYC. On the pop culture side, one of the most popular costumes this year we think is going to be the Labubu. If you're not familiar, it's a quirky, crazed-looking doll, people call it, that sparked a worldwide buying frenzy. Think of a creepy Beanie Baby if you're of that generation. Or maybe the K-pop Demon Hunters characters will be huge this year, probably mostly for kids. Or any other character from pop culture in 2025. Who are you or your children going as later today? 212-433 WNYC. Call or text, and we'll take your politics or pop culture costumes right after this. Brian Lehrer on WNYC. Okay, we're getting a lot of political Halloween costume call-ins here. So we'll start with Harris in Brooklyn. Harris, you're on WNYC. Hi.
Hey, Brian. How's it going? This is Harris Alterman, longtime listener, first-time caller. My wife, her costume, she is going as Cash Money Patel. So it's half Cash Patel, half rapper. So she's got a FBI hat, an FBI jacket, and she's got a big chain with a big dollar sign on it, and she's going to have the big patented Cash Patel wide eyes.
Wow, hilarious. Julia in Ridgewood, I think, has another Curtis Lewa take costume, huh? Hi, Julia.
Hi, yeah. So my boyfriend and I, it's a couple's costume. He's going to be Curtis Lewa. We went to the hat store downtown, a very excellent place to get a hat if you need one. It's next to Milano's. And I'm going to be one of Curtis Lewa's cats, dressed in a red blanket. And I also got my nails done to match the occasion. I have Curtis Lewa's hat and also a little 3D cat wrapped in a red blanket on my nails, as well as a whole 70s New York motif.
Thank you, Julia. Here's kind of a dark one. Listener texts, my costume is a bag of ice. Joanna in Sunnyside, you're on WNYC. Hi, Joanna.
Hi, I'm sharing my husband's brilliant idea, which is to dress as one of the most frightening things right now, private equity. He's going to do a quarter zip, a puffy vest jacket, and just a sash that says private equity.
Thank you very much. Madden in Queens, you're on WNYC. Very much on the news, I see. Hi, Madden.
Happy Halloween, Brian. I'll be dressing up as a Louvre robber, making sure I have some French elements with a beret and a baguette and a bunch of jewels from the 99-cent store.
Wow. Don't make the beret red or they'll think you're French Curtis Lewa.
Exactly.
Thank you very much. Carrie in Croton-on-Hudson. Hi, Carrie. You're on WNYC.
Yes, thank you. Happy Halloween. I'm going as the Statue of Liberty, and I'm carrying the Constitution. But I also have a sign that has a pigeon, a picture of a pigeon, and it's saying "Coo," C-O-U-P, and it says even the pigeons know what's going on.
Coo.
So,
Carrie, thank you very much. Linda in New Orleans. You're on WNYC.
Hey.
Hi, Linda.
Hi, Brian. Hi, thank you. Those are all really great. You're making me laugh. They're making me laugh. I'm going as Frida Kahlo with a sign that says, "Oops, I deported myself." And I feel a little bad about it because I love Frida Kahlo so much and I don't want to make fun of her, but I also feel like it's important to take a stand. And in New Orleans, it's tricky because there's some blue bloods here, and they kind of looked at my sign when I wore it yesterday and said, "Wait, what?" So, but I'm doing it anyway.
Thank you very much. Now, here's a text. I was going to be an orca breaking a yacht for Halloween this year. I bought an orca onesie. It was not cheap, but then I found out that my cousin, who was sailing near Portugal where the whales are prevalent, had his boat attacked by an orca on October 10th, so I decided not to do the costume. But maybe I will wear my orca onesie as a protest. All right, one more. Brett in Queens, we have 15 seconds for you. I see you have a long history of political costumes. Do your best, 15 seconds.
Thank you for taking my call. In 2016, I went as social media. In 2012, I went as Obamacare. And in 2008, I went as binders full of women. That's it. Thank you.
Mitt Romney. Anything this year?
Still social media. Going to stick with that one.
Thank you very much. All right, listeners, thank you for all your Halloween costumes. Maybe you gave some other people some ideas. Whatever you do tonight or this weekend, have fun, eat candy, stay safe, give away stuff. Have a great weekend. Thanks for listening to Brian Lehrer Weekend. We're back on the radio Monday morning at 10 a.m. In the meantime, follow us on Blue Sky at The Brian Lehrer Show, where there's always a conversation 24/7.